Assalamualaikum warahmatullahi wabarakatuh. Today, our group would like to present about a topic of MRI machine. Okay, so first of all, let us introduce ourselves. Myself, my name is M.Sohail bin M. and my metric number is 221902.
Assalamualaikum. Now my name is M.Dzulhisyam bin Zulkifli. My metric number 221847.
Assalamualaikum warahmatullahi wabarakatuh. My name is M.Fazwan bin Fazli. My metric number 221857.
My name is M.Afiq Mifzal bin Al-Bashar. My metric number is 221917.
An MRI or magnetic resonance imaging scan is a painless test that produces very clear image of the organ and structures inside your body. MRI use a large magnet, radio wave and a computer to produce this detailed image. It doesn't use the radiation like X-ray. So there are two types of MRI. The first one is closed bore and the second one is open bore. So for the closed bore MRI, it have a ring of magnet that form an open hole or tube in the middle where you can lie to get the organ and structured image. Closed bore MRI are narrow with tight and small space in it. So this MRI machine take the best quality of image, but it can cause claustrophobia, anxiety and discomfort for some people. For the second type, which is open bore, is used to counter this problem. So open bore MRI has two flat magnet positioned over and under the patient with a large space between them for the patient to lie. So this allow an open space for two sides and alleviate much of the claustrophobia for many people have experienced with the closed bore MRI just now. However, the open bore MRI doesn't take clear image as the closed bore MRI.
Magnetic resonance imaging (MRI) produce detailed image of the inside of your body. Healthcare providers can look at and evaluate several different structures inside your body using MRI, including first one, your brain and surrounding nerve tissue. Second one, organs in your chest and abdomen. And the third one, the breast tissue. The fourth one, your spine and spinal cord. And the fifth one, pelvic organs. And the sixth one, blood vessel. And last but not least, your lymph node. Healthcare providers use magnetic resonance imaging (MRI) to help diagnose or monitor the treatment for many different conditions. There are also different types of MRI based on which area of your body your provider wants to examine. Brain and spinal cord MRIs can help evaluate and diagnose the following conditions. The first one, brain tumors and spinal tumors. The second one, the providers use cardiac heart MRIs for several reasons, including to evaluate the anatomy and function of your heart chambers, heart valve, size of and blood flow through major vessels and the surrounding structures. Body MRIs can evaluate structures and diagnose several conditions. Healthcare providers sometimes use breast MRIs with mammography to detect breast cancer, especially in people who have dense breast tissue or who might be at risk of a breast cancer.
An MRI scan is generally safe and poses almost no risk to the average person when appropriate safety guidelines are followed. The strong magnetic field the MRI machine emits is not harmful to you, but it may cause implanted medical device to malfunction or distorted the image. There's a very slight risk of an allergic reaction if your MRI requires the use of contrast material. These reactions are usually mild and controllable by medication. If you have an allergic reaction, a healthcare provider will be available for immediate assistance. healthcare providers generally don't perform gadolinium contrast enhanced MRIs on pregnant people due to unknown risk to the developing baby unless it absolutely necessary. In most cases, an MRI exam is safe for people with metal implants, except for a few types, unless the device you have is certified as MRI safe. You might not be able to have an MRI. This device may include metallic joint prostheses, some cochlear implants, some types of clips used for brain aneurysms, some types of metal coils placed within blood vessels. If your healthcare provider recommend an MRI scan, they will ask detailed questions about your medical history and any medical device or implants you may have in or on your body.
MRI uses magnetic fields and radio waves to measure how much water is in different tissues of the body, maps the location of the water and then uses this information to generate a detailed image. The MRI scanner is essentially a giant magnet. The strength of the magnet is measured in a unit called Tesla. Most MRI scanners used in the hospitals and medical research clinics are 1.5 or 3 Tesla. Putting that into perspective, the Earth's magnetic field is around 0.0006 Tesla. A 3 Tesla MRI scanner is around 60,000 times stronger than the Earth's magnetic fields. These items include jewelry, watches, credit cards, and hearing aids, all of which can be damaged. Pins, metal hair accessories, underwire bras, and metal zippers which can distort MRI images. Removable dental work such as dentures, pens, pocket knife, and eyeglasses, body piercings, cell phones, electronic watches, and tracking devices.
Yes.
Zul, just now you did mention that there are items that can enter the MRI machine, but I've got a question for you. What happens if the items did enter the MRI?
Okay. For explain this question, let us see this video beside me.
This is a ferrous metal object, meaning it contains iron, and this is an MRI machine, and this is what happens. MRI stands for magnetic resonance imaging, so it's basically a giant magnet, and if you get anything that is ferrous metal, meaning contains iron, it can get sucked into the machine rapidly. This is an example of a gentleman who wore a butt plug that he thought was silicone only, which is what the manufacturer said on the label. Turns out it had a metal core that was ferrous metal, and it got sucked into his abdomen and nearly killed him. That's how strong these magnets are. They can suck entire stretchers into the machine themselves, chairs, monitors, you name it. Now, non-ferrous metals like aluminum or copper or silver or titanium are okay. Those are MRI compatible. You won't get sucked into the machine, but regular metal that contains iron will. So people sometimes ask when this happens, why don't you just turn the MRI machine off? Well, if only it were that simple. It can cost about $50,000 to power it down and then power it back on. It can damage the MRI machine permanently. So just be careful. No ferrous metal, please.
You get the idea?
As a reflection, we must to believe that every disease has an antidote, and there are various ways to treat the disease. Either use the traditional method or use the technology. And Allah promises every trouble for pleasure. As Allah mentioned in Surah Al-Inshirah, verses 5 to 6, A'udzubillahi minasyaitanir rajim, fa inna ma'al usri yusra, inna ma'al usri yusra. It means, so surely with hardship comes ease, surely with that hardship comes more ease. In addition, we need to believe that Allah is all healing of all diseases. As Allah mentioned in Suratul Ash-Shu'ara, verse 80. A'udzu billahi minasyaitonir rajim. Wa idza maridtu fahuwa yashfin. It means, and He alone heals me when I am sick.